Hello everyone, welcome back to DSM video. I'd like to continue now with sexual desire disorders. We're going to first start with male hypoactive sexual desire disorder. It is defined as a low level of sexual interest and desire that is manifested by failure to initiate or be responsive to a partner's initiation of sexual activity. Male hypoactive sexual desire disorder becomes diagnosable when it causes a marked distress within the individual. Oftentimes people won't complain about this, and therefore it's not a diagnosis. You'll see that is very common throughout some of these disorders. The patient usually complains of a lack of interest in sex, even under circumstances that are ordinarily erotic in nature. The treatment, there's currently no approved medication or drug or pharmacological treatment. Psychotherapy has proved to be only minimally effective. The primary goal of therapy is aimed to remove the underlying cause of this sexual disorder. If the cause is related to a medical condition, then therefore therapy is directed at reducing that the medical effect on one's life, and perhaps in hopes that this disorder will follow. The current research is finding that it's almost impossible or very difficult to predict the occurrence of hypoactive sexual desire disorder. Understanding of support of the sexual partner is very important. It's essential in those cases for recovery, especially in the case when the cause may be temporary or transient. Some therapists recommend a period of abstinence from sex and have emphasized the value of non-genital sex in the treatment of hypoactive sexual desire disorder. Moving on, we have female sexual interest arousal disorder. What is female sexual interest arousal disorder? It's kind of a mouthful. I probably shouldn't have said that. Many women experience issues with sex at one point or another. It can also come on at any point during one's life. Sexual responses are often a complicated amalgamation of emotions, lifestyle, biology, and beliefs pertaining to sex. A disturbance of any of these factors may lead to female sexual interest disorder. So non-medical treatments include talking. Often communication can solve a variety of the issues between partners. Seeking counseling, using a lubricant or device, or other solutions to help build just a healthier lifestyle. Other medical therapies such as estrogen and androgen therapy play roles in stimulating sexual function in women. Since included in the DSM-5, researchers are working to shift the language of diagnosis from desire to a lack of responsiveness to a partner's advances. They have also shown that by helping women relate differently and more positively to their sexual bodies, that they can help women with this disorder. The next category is sexual arousal disorders, which is essentially the same as what the last category was, so these will just be lumped together. What is erectile disorder? Erectile disorder may be defined as a consistent inability to achieve and maintain an erection sufficient to permit satisfactory sexual intercourse. It is well recognized that adults of all ages view sex as an important quality of life issue, and that an imposition of erectile disorder usually results in a reduced quality of life. The main symptom of erectile disorder is an inability to maintain an adequate erection to complete the sexual activity. Men may experience depression or anxiety, some marked distress, and it may cause marital issues. So the first treatment in The first step in treatment of erectile dysfunction includes elimination or modification of risk factors or causes. This may be due to alcohol abuse, obesity, smoking, an alteration of a prescription that one is currently on. Current research finds that at least 30 million men are suffering from some degree of erectile dysfunction. Between 10 to 20 have a severe degree of erectile dysfunction, and this is projected to increase by nearly 10 million affected men by the year 2025. Alright, we'll do this one as a new category.